Now patient is on its position. We have cleaned the area with antiseptic solution. Now where do you inject? Now you should inject in the most tender spot. But I will try to give you a landmark. So if I draw up, this is the medial malleolus, this is the anterior border, and this is the posterior border. So draw a line going straight down following the posterior border of the medial malleolus. And the second line is usually a finger breadth above. And so if I draw a line here roughly, if you saw as I draw the patient winch, so usually this will be the most tender spot. So this is the point at which we are going to do our injection. So other findings that you will see in a lot of patients with plantar fasciitis is if I dorsiflex the toe, you will see the medial border of the plantar fascia becomes prominent. So if I just show you here, you can see the medial border of the plantar fascia is getting prominent. Usually it's the medial side which is inflamed, and hence when you press on the medial side, you get the typical tenderness of plantar fasciitis. Now in terms of approaches, there are two approaches commonly used. One is you can go through the sole like here, and the other you can go through the medial side. Now I would recommend that you don't use the approach through the sole for two reasons. First, the skin of the sole is very thick, and if you pierce it, it's very painful for the patient. Secondly, it leads to a higher percentage of fatty atrophy. So I would never recommend you to do injection through the sole, even though it is a direct approach. But I would recommend that you don't use it. So the approach that we are going to do today is the medial approach, and I have shown you how to come to that area of interest or area of injection. Now in terms of cocktail, if you are doing an ultrasound guided technique, you can just use 40 mg of dipomedrol with few ml of 1% or 2% xylocaine plain solution. However, since we are doing this blindly, I usually use a slightly larger, so this has got 40 mg of dipomedrol, and I have mixed it with around 2 or 3 ml of 1% xylocaine solution. So now I'm going to show you how to do this injection. Now this is our mixture loaded. I'm just going to give it a shake. Try to use a smaller gauge needle, because then patients will feel less pain. So we are going through our area that we have identified, and we'll just take it deep. You want to aspirate and then slowly inject. Now while injection, you have to be sure that you don't want to inject majority of it in the fat or directly into the plantar fascia. So it's slightly discomforting for the patient, but as soon as the effect of the local anesthetic starts to take over, the patient will report of the pain, which is much better. So this is the injection gone. So just take this away and your injection is done. Now the advantage of the medial approach is that the patient can straight away walk after this procedure and has got a very low incidence of fatty atrophy, and it is much less painful for the. If you like our videos, give us a thumb up, like, share and subscribe. Thank you very much.